Hello there. My name is Amina King and I'm currently a third year nursing student approaching the end of my Bachelor of Nursing degree. I'm extremely excited to have the opportunity to start a graduate nurse program in 2020. I like to think of myself as a trustworthy, empathetic and respectful person who has a passion for looking after others. I've had the privilege of completing placements in a variety of different settings from rural, city and community. This has enabled me to develop my knowledge, critical thinking and clinical reasoning and prepare me for the many situations I will come across as a registered nurse. Along with my study, for the past year I have also been working in an aged care facility as a carer. Working as a carer has enabled me to improve on my communication skills by building therapeutic relationships with my residents and my co-workers. It has also equipped me with the skills to provide safe, appropriate and responsive care for the residents, and I have then been able to apply this to my nursing in a clinical placement setting. Today I will be talking about the contemporary transitional factor of horizontal bullying and how it influences newly registered nurses. Horizontal bullying, as stated by Becker and Vysovsky in 2012, is considered an act of aggression amongst nursing professionals. The Australian Human Rights Commission in 2012 describes bullying as people intentionally and repeatedly using actions or words against someone to cause distress and risk their well-being. These words and actions are typically done by people who have power or influence over someone else and aim to make them feel helpless. In 2012, a study conducted by Farrell and Shuffy listed the contributing factors towards horizontal bullying. 83% of registered nurses that took part in this study cited that the perpetrator's personality was the main contributing factor. The Australian Human Rights Commission 2012 states that those who bully are likely to do so to dominate others, and they can also not see that bullying is morally wrong. When horizontal bullying is occurring in the workplace towards newly registered nurses, it creates poor staff relationships. As outlined by the Nursing Midwifery Board of Australia 2016, the second standard for practice for registered nurses is engages in therapeutic and professional relationships. Poor relationships amongst nursing colleagues causes distress, resulting in nurses feeling less confident in the workplace and can lead to things such as low self-esteem, anxiety and depression. This directly impacts on the quality of care provided to patients. As discussed by Becker and Vysovsky in 2012, the physical and psychological effects of horizontal bullying puts the victimised nurse in a poor position to care for the patient, and the patient's safety is then compromised. This is detrimental and contradicts the code of ethics registered nurses must follow as outlined by the International Council of Nurses in 2012. Horizontal bullying of newly registered nurses is unacceptable. This contemporary transitional factor, however, is complex and requires a multi-layered solution. Badley et al. In 2017 suggests to address this issue, student nurses need to be educated while still at university about the types of behaviours that classify as bullying and the reporting options available to them. This will then give them the skills to build resilience and communication that they can take with them into the workforce as newly registered nurses. Promoting a zero tolerance towards bullying and encouraging newly registered nurses to report these behaviours will enable this contemporary transitional factor to no longer be an issue in the future.